Welcome to 90 Degree Turns. I'm your host, Trisha Marcus. Allow me to guide you into your own endless soul expansion as we connect to your heart, discover balance, awaken to healing, and embody your soul's deepest expression. For those of you hungry to expand your mind's beliefs and perspectives, welcome home. Dr. Sebastion Lomas is a biological holistic dentist who has always had a strange magnetic pull towards the practice of dentistry since childhood. As his life journey evolved, he found himself studying biochemistry in university, and eventually life brought him to King's College London, where his passion for dentistry could be actualized. He is grounded firmly in helping remove oral interferences and imbalances to the human organism which reflect and/or originate in the mouth. In the field of holistic dentistry, there is an overlap of high-tech dentistry and integrative functional medicine with biohacking to achieve optimum well-being. Biological dentists believe that your oral health is fundamentally connected to your overall health and well-being, understanding that problems of the mouth can, and often do, reflect other areas of the human organism. With all that being said, enjoy diving into this episode where we'll cover the implications of mouth breathing and how to become better nasal breathers, how parents can best support their child's long-term dental health, TMJ, and more. This is Trisha. I'm joined today with holistic dentist Dr. Seb. Dr. Seb, how are you tonight?
Oh, I'm amazing, thank you. It's a beautiful spring day in England, which is rare. Sun's out, so I was just enjoying the sun, and I was looking forward to this all weekend. So yeah, I'm very well. How are you? Are you good?
Yeah, I'm doing good. We've got what appears to be a sunny day outside, but it's deceptively cold out. So it doesn't look like spring has completely sprung here just yet, but hopefully winter will be on its way out soon. So I'd love to get into your journey, Dr. Seb. So let's just dive in. Like, how did you get into holistic dentistry? How did you transition from the concept of like allopathic, Western, more a Western approach, and find yourself in the field of holistic dentistry? And what are the differences between these two paths?
Yeah, it's a series of synchronicities really over my life. And yeah, if we get really into where it all started, I loved science as a kid. And then my parents were like, well, what do you want to do then? And I was like, well, I don't know. What can you do with science? And they're like, well, you can do, the classic doctor, medicine, scientist, la, la, la. And I was like, okay, I'll just go and do work experience in all of them. And I loved the dentist. I worked in a dentist, I think from like 12 years old. I was dental nursing and I was on reception. And I just had this amazing affinity for helping people in that way because it's such instant rewards for people that are in pain, and they come in and they just you can instantly take someone out of pain by giving them an anesthetic for a toothache, for example, and then doing whatever's needed to be done. So I had that connection when I was younger, but I actually didn't get the grades, and I I was very big into my sport, and I focused on my sport a lot more than my education in my first till I was probably about 20, I would say. And I actually went to university the first time to study chemistry and biochemistry. And then I thought, well, I don't know if I want to do 3 years and another 5 years in dentistry. I think what I want to do is just earn money, and I think it'll be fine. My life will be complete. It's all about money, la la la. So I was like, okay, I'll get the best job that I can on a graduate scheme in London and just see how it goes. And I ended up working for a massive IT company and in their sales department, earning amazing money, but hated the job. Absolutely hated the job. And then I got really ill in this period because right before I went to yeah, so it's an emotional story, but right before I went and started that graduate scheme, I went traveling around South America, and I ended up in this crazy adventure, and I ended up in intensive care in Bolivia for a week and missed all my flights home and la la la. But obviously you think at that point, right, I'm just going to get to hospital, they're going to fix me, I'm going to come out and I'm going to be fine, I can live life like I want to live, right? And that's when my eyes opened to the holistic world, because I was in intensive care. I got back to the UK and my immune system was just not working at all. So then I was like, ooh, what do I do? And this is when I actually met my wife on this graduate scheme, but her and her whole family are very holistic, right? And something that I've never had from my family, because they're all very medicine and chemistry and scientific, has to be proven, which was really interesting. And but I was still not wanting to connect with that side, and I was going down this, I had private medical care against all these top doctors and immunologists in London, and it was just leaving me no answers, and actually was making me more ill and more frustrated, more depressed emotionally as well. And I was just feeling so disconnected from life, really, and it was just like this monotonous cycle. And anyway, I went to this, in the end I said, okay, Ali is my wife, and I'll go and do it. I'll go and try all these nutritionists, try the homeopathists, try, homeopath, sorry, try the essential oils, and I'll cut out sugar, I'll cut out alcohol, I'll meditate, all of these things, because she was nagging me for a good part of 12 months. And, the results were incredible. And actually it's what kind of led me into the test before you do, because I did so many tests around what was in my gut, what was in my microbiome, what was in, where was I displaced, what parasites I had, and that's how I could focus on what to take naturally to help with these things that were encumbering my system. And one of the immunologists that I actually was working with, he said, well, what are you doing with your life? And I said, well, I don't know, I'm in sales. And he said, what degree did you do? I said, oh, I did chemistry. He said, did you do well? I said, yeah, I got first. And he said, oh, right, well, what did you want to do? I was like, well, I always wanted to be a dentist. He's like, okay, I'll put you in contact with someone at King's College London then. And I said, what? Okay. And then this whole world of dentistry just opens itself back up after I'd unlocked that new way of thinking, right? And then ended up studying on an accelerated course. And my wife at the same time was having different health issues around chronic headaches, migraines, and she in the end, it's really long story short, but she had to, when she was younger, she had 4 teeth removed for braces to make her profile look good and to make her teeth look good. And that was the cause of her forward head posture, her inability to breathe, her clenching and grinding, which led to her jaw joint degeneration. So at the same time as me studying, I was watching my wife undo all these problems through dentistry, because what happened in the end is she had an osteopath and cranial osteopath to kind of move her jaw into position, but then her teeth, when she would bite, would go back into the old position. So then she had to have dentistry to open her arches up back to where her skull should be and her jawbone should sit. So I was studying the allopathic way whilst learning the biological, the holistic way at the same time. And it was just amazing, really. And then I've just gone from mentor to mentor, shadowing, learning in all my spare time, reading all the books. And it's really not a degree in biological holistic dentistry. It's more like a passion and a drive to do things differently, look at the pictures differently, see how things piece together, and not really just going on what science is proving a lot of the time, because everyone's unique and everyone's individual, right? We can't treat everyone the same way. So that is a long story, I know, but that's how I kind of got into it. And my first mentor, the lady where I did all the nursing stuff, she was very spiritual, and she was would tell her patients to meditate and tell them to relax and say, you're putting pressure on your teeth, this is what's causing the toothache. It's nothing to do with decay or gum disease, it's you and your mental psyche, and just take some time out of your day and give 5 minutes a day. And so I've had all these little areas fed through my whole life that have directed me. And so I'm a big believer now in trust the process.
Yeah, definitely. I'm a firm believer that the universe will always bring you what you need. And if you need course redirection on your path, you will get redirected one way or another. I'm sure many people listening to us in our audience, they could relate to the experience of having issues that allopathic medicine just simply couldn't get to the core of solving. Like instead,
Absolutely.
maybe they were given a set of pills, or they were told that they were just making their symptoms up, right? I mean, it's a very common problem that happens within Western medicine. And it's not to say that Western medicine doesn't have its time and place, but with our bodies being so diverse, not every issue can just be like diagnosed by the book. So you do mention something interesting with experiencing an interesting experience with our jaw structure and tooth alignment, and how it's like completely interconnected with the rest of the body. Like it's a live being. It's an entire ecosystem in itself. So I'm sure you're familiar
Yeah.
with the meridian systems in the body. It's a lot to dive into, but how can we make the connection between tooth health and the meridian system? How does one impact the other?
Yeah, and actually, is it the chicken or the egg, right? Which way around does it go? Because I've had many a patient. So, for example, the first big molars, they are lung, large intestine, and grief, right? And if someone's recently passed in their family very close to them, and they've got all this grief on their mind, they've not expressed, they've not allowed to release, it will come, the body's intuitive, right? And it'll express its way, which is easiest. So if the person's not willing to look at that and to feel it, to heal it, then the body will have pain in these expression areas of along that meridian point, and the tooth may be on that part. And, it's just sometimes, even with helping patients heal from infections, and the infection's not healing, you think, I'm doing everything I do for every other patient, but why is this not happening with you? And then you have to go into so in the dentistry that I do, we really play a part and look at the meridian for if there's anything going on, and say, like, what is the emotion attached to this tooth? What's happened recently in the past? Well, it doesn't even have to be recently. One of my greatest mentors, Elmar Young in Southampton in the UK, who's an amazing surgeon, but before they have surgery of him, he goes on, has this biophoton therapy, which is trying to open up what blocks are you having to healing, because obviously everyone's coming to heal from either this life, an emotional, physical, or spiritual, but also past lives. And it's just incredible. And before this treatment, his success rate was probably 80s to 90s on these big surgeries, but he said it's 95 plus now since adding this treatment and allowing patients to feel it, to heal it, and bringing these things to their psyche so that they can understand it. And that's almost like resonating with the frequency of the light associated. It's really complex treatment anyway, but it brings these things up to these patients. Biophoton therapy, if anyone wants to go and search it, it's pretty amazing. And the practitioner that deals with it is got to be skilled to understand how to bring these tense areas up into your system. But yeah, every tooth, normally groups of teeth, have organs that are associated from, and these organs actually track back to the developmental process, when we're a fetus, and how they extend from that line of development scientifically as well, which is quite interesting, isn't it? But then also the emotional aspect to each of the teeth as well, and how that can stop us from understanding what's going on within the healing aspect of that tooth individually. And it's so important. And if something's not going quite to plan, I mean, you then ask the patient, and you really understand that before you do the big surgeries, because there's no point. It's like, you've got to work both ways, absolutely both ways.
Yeah, wow, yeah, there's so many questions I have. People suffer for so many different things within the body. What if we start off with what advice do you have for parents? What is the best route a child could take in order to have the most like optimal success in relation to their oral health? How can parents best support or invest in their young child so they won't have to fix issues down the line?
Yeah.
I saw this really interesting post you made on your Instagram where it showcased how jaw alignment, whether it was like an underbite or an overbite, and it showed how it had long-term implications of the actual standing posture of the body. I feel like that's so incredible, the connection there. So
Yes.
there's clearly lots of implications for early prevention. So
Yeah.
what do you think about all this?
Ooh, this is a huge subject. Let's dive into this one then. Okay, so let's just assume that you've got a newborn. Okay, even before a newborn, it's the while an embryo fetal like the whole pregnancy, we need to be almost allowing. So obviously you've got the nutrition first, right? And we always talk around that. Nutrition number one, but also emotional support number two, reduction in stress and anxiety, because that will surge in the baby that's developing as well. I mean, these things are impossible a lot of the time in the world that we live in. So you've just got to be kind on yourself and do as much as you physically can, right? But you've just got to say that 9 months is as much as I can help my little one that's growing and developing inside me. Reduction in stress, you know, mobility and exercise, good hormones, good thoughts, good visualizations, good meditations, good nutrition and supplementation. Because one of the most key things is when a newborn's there, you know, breastfeeding, if you can, and hopefully 90% of us can, is the number one thing for growth development, because all infants do when they come out, right, is feed, digest, and sleep, right? That's it. And we need to make sure that they can feed correctly, which is normally assessing for lip ties and tongue ties. So you can get your tongue. And the most important thing for growth and development, like the tongue is like the epicenter of development for babies, really, because one, locally, we've got the structure of the jaw. Like if you're feeding on a nipple and a boob, you have to have the baby upright, not back or not leaning back, because you want them to use their tongue in a method that pushes up and back, which actually grows and develops the arch and actually gets them drinking milk without the air, because otherwise they're pushing their tongue forward to stop the flow. And that they can have something called aphasia, which is like wind digestion, and then they're really not digesting food very well, right? And then that puts them into fight or flight, so then they don't develop in that whole sympathetic nervous system response. So the whole build up to birth is getting everything right so that lip ties, tongue ties don't develop, because a lot of the time it's through improper finalization of the growth process. So, and that can be from nutrition, that can be from stress, that can be anything, it can even be you know, traumatic births as well. So working with someone that, I mean, craniosacral therapy is like one of the best modalities that most midwives actually now recommend to decompress the skull, to allow the kid and the baby to be more present and more focused on what needs to be done, which is eating, feeding, sleeping, right? And calm about those things. And if we have a tongue tie, lip tie, we can't breastfeed properly. We don't get air, we get air in, we don't develop our arch, we don't develop our system because we're not getting the food, nutrients, and digestion as well. So that's so simple. And the proper posture, which is upright feeding. They are like the most fundamental things for the first 6 months, I would say. And then once we've got the first teeth that start coming through around 6 months time, over the next like 2 years, you want to start being, you know, I think there's so much conversation, isn't there, about how long to breastfeed for, right? And even if you can't breastfeed, by the way, don't be hard on yourself. There's pretty good bottles now you can express, and you can use these ones that mimic the breast and things like that, which are really good for the growth and development as well. And it's the same thing, just make sure the posture's right, you know, so the baby can use the tongue the same way that they would do through natural breath, through breastfeeding alone. And then what we want to do when the teeth start coming through is introducing hard, crunchy foods, which start to stimulate the growth and development of the jaws, because it's a bit of it's probably the biggest pandemic in the world, is no one's getting enough room in their jaws for all 32 teeth anymore, unless you're living in these remote areas, right, that eats these diets that has, none of us have enough space. I mean, minimal. It's like 5% of people have all 32 teeth in the mouth now without impaction, which is the wisdom teeth, right? They always come through wrong.
Yeah, I was gonna say, is that why people pull out their wisdom teeth? Because there isn't actually enough room in their space in their jaw.
Exactly.
Properly?
And instead of our intervention expanding the jaws and recreating what we've lost through all the hunter-gatherer foods and nutrition that we used to have from the fat-soluble vitamins, you know, like the bone marrow and the things that we would have crunched on to grow and develop those jaws, that might not be your thing, and you don't have to eat like that, but at least you can introduce harder things like celeries, carrots, anything that's more solid formed when the babies can chew it, when they start developing their molars around 1 year old. That's what I start saying around the breast is best up until about 1, and just introducing some foods within the diet around 6 months, but the harder crunchy foods when they start getting their chewing molar teeth at the back, which will continue to grow and develop the arch. And what we want to see in kids is gaps forming between their baby teeth, right? Because adult teeth are 30% bigger than the baby teeth. So we need to have enough room for those adult teeth. Otherwise, we need to do some intervention. And if we're looking at, and if our kids are developing things like decay or gum disease is very rare in kids, but mainly decay, then we've got to look at why is that going on? And that could be nutrition, mostly, I would say, or immune system, autoimmune. So it could be irritated to the very toxic world that we live in, and they get developing allergies to the foods that we're eating, or we're introducing foods that, you know, maybe dairies and glutens and grains that aren't they're irritating the gut, and then we're not. Because I think we've got to really focus on our teeth about living organisms and how they're alive, right? And it's only the enamel layer on the outside that that isn't alive, and it is alive to start with, but when the teeth erupt, the cells vanish because the food wipes them off, because they erupt with the teeth. And the dentine and the pulp in the middle, they're very much alive, and they feed the enamel all the nutrients from within the tooth outwards. Now, if we do things like, especially kids, if we clench and grind our teeth, which is very common, and we mouth breathe as a kid, normally from incorrect feeding and low tongue position. So if we do those two things and we start developing cavities, because the pressure we're putting on our teeth weakens them, and the mouth breathing dries the saliva out and dries the teeth out so they can't remineralize themselves, then we need to do some more intervention, and we need to say, right, how can we mimic the things that we're losing here? And that's usually through the right foods, introduction, and training the kids around nasal breathing and chewing and swallowing in the right way, which then stimulate the bones and the teeth to grow, well, the bones to grow in that forward and upward motion again, to have the space for the adult teeth. So that's like the biggest thing, because if we that's up to like 6 years old, and then when we're 6 to 14, we want to just continue those habits and introduce those habits. And working with biological holistic dentists, or they call them like functional orthodontists, or someone that's going to know about the jaw and growth and development, to work with everyone, and the mums and the dads, especially with the kids, because it's a lot of effort for mums and dads if they're not going in that right way, because they've got to kind of get the kids on board. And that's part of the practitioner's role as well. But if we have all of that in the right way, and our posture and our neck position, if our teeth are in the perfect structure and there's no crowding, because like you said, alluded to earlier, if you've got an underbite, you're kind of like more turned under, and if you've got an overbite, you're kind of more head forward and pushed out. That, imagine the holistic problems that has on all the fascia and all the muscles that are connected to your whole body. So if we can grow in a straight, nice, airway centric way, then our kids are going to be much healthier for much longer. And that's not even talking around how we breathe at night, and whether we're clenching and putting our body into fight or flight when we're meant to be resting and digesting and regenerating, which can be a whole compromise of the airway issues I'm sure we'll talk about in a bit as well. But yeah, that's how you get the most holistic view to start with, to just focus and introducing materials that aren't toxic and blocking those meridians, for example. You know, quartzy, crystally type fillings in kids are nice ones that are very temporary materials, but they go in, they don't traumatize the kid, because dentistry is a new, scary, strange world. So you don't really, for me, I barely fill teeth in kids, because if we change the brushing, diet, nutrition, breathing, clenching, the teeth last long enough then to exfoliate and then allow the adult teeth to come through. And you don't want to put kids off when they're so young. So many traumatized adults from that, right?
Yeah, I myself wasn't a big fan of the dentist as a kid, with all the different sounds and things that went on there. But so speaking of these quartz fillings, so I didn't know this was even an option. So is this like an alternative to traditional metal fillings that most adults are accustomed to?
Yeah, I mean, technically all around the world now, we should be phasing these metal fillings out, because they contain like 53% mercury in them. And already in the UK, 2018, I think it was, 2018-19, they phased, well, they said by effective immediately in 2018, not placed under anyone under 16 years old, anyone with neurological conditions, any nursing mothers or pregnant women, and you think, well, if they can't go in those people, why can they go in everyone else? They're just the higher risk people, right? So and I know America's the same, and I know Sweden and Germany, not Germany, Sweden, all the Scandinavian countries, they they stopped it like 10, 20 years ago, which is just they banned, they just banned metal fillings completely. So yeah, these quartzy crystals, fillings, I mean, nothing's perfect. This is what we've got to realize. The dental materials in general aren't as good as our natural tooth substance, but sometimes we do need to use them. And if it's too soon before the tooth is meant to exfoliate or lose, before the adult teeth, we need to do an intervention, and you've got to try and do the least invasive, minimally invasive, and minimally like interfering. So the quartz ones are called glass ionomers. They do have, there's some negatives about them. They've got a little bit of fluoride in them, but the fluoride is used to bond to the crystal of the tooth. So if that patient doesn't use fluoride, drink fluoride water, use fluoride toothpaste, it's not ever going to readmit fluoride. And I always say it's like drinking a cup of tea, unfiltered water. That's basically the equivalent of it. And it has small amounts of aluminium as well, but that's used in the crystalline structure to make it strong. Again, probably will leach very small amounts over the years, but it's not a forever filling. So, I mean, this is the thing. It's not a non-toxic world, unfortunately. We've got to use the best things for the function of the tooth as well as the most biocompatible. And there's always a trade-off, but they seem to be the best ones. You do have like BPA-free plastics as well. But there's some element of monomer resin in there, which are quite toxic to human cells in kids. So it's like, oh, what do you choose? And I just give my patient parents, all of the options, and they make the choice themselves, right? You know, it's informed consent fully.
Yeah, that's what we need more of in this world, having a table of options where we can choose using our own discretion in our own research. And you can't really get away from every toxin in the world unless you live in a remote cave far, far, far away from society. And for most of us, that's not a realistic option. So we have to have an alternative from something that is as poisonous as mercury fillings, and replacing it with quartz crystal is a great idea.
Absolutely.
I mean, at least it gives us an option, and perhaps it's a step above other alternatives that maybe aren't as healthy. So you did mention grinding of the teeth. So what causes this grinding? How does it relate to TMJ, and what can we do to remedy it?
So TMJ, the medical name for it is temporal mandibular joint. So it's the joint between your mandible and your skull bone, which is the temporal bone. And there's a bit like your knee joint, there's a little disc that sits in between it, separating the two. And obviously this is a hugely variable joint, because when we're growing and developing as a kid, if we have things like a narrow arch or very deep bite or a very big lower jaw that's grown bigger, these things obviously change the shape of all the bone structure because they have to grow in a different way. And some of these things lead to TMD, which is temporal mandibular joint disorder, which can be caused by a whole cascade of things, but the easiest one is just the bite is slightly wrong. And so if you bite and slide, so if you bite like this, and if you have a bite and a slide to find the position that's more comfortable, your brain constantly wants to slide into that place. Or if there's a contact on one side, not a contact on the other side, you can have an occlusal interference, and your muscles on one side will probably work harder to try and close that side that's got a slightly open bite. And so TMJ, that's the fancy name for it, temporal mandibular joint, and you have a disorder of the joint. But the way that I coach people and the way that my mentor John Roberts taught me was teeth, muscles, and jaw stands for TMJ. Easy, right? If the teeth are in a wrong position, the muscles can spasm, causing headaches, migraines, all of those type of things. And the jaw joint can dysfunction and cause arthritis, cause inflammatory mediation, can put your whole body into inflammation in general by releasing like substance P, these chemokines that you don't really want circulating your system all the time. And that can just be from your jaw not functioning in the right way because you never grew and developed and what in the perfect ideal way. And remember when I said when you're younger, if you start noticing your child's got very crooked teeth, very narrow arch, very deep bite, at 6 years old, you want to be working with someone. A myobrace practitioner is a really good one that can be teaching your kids to breathe, swallow, and chew in the right way. And that will influence how the jaws grow and develop, right? To negate this TMD when you get older. Now, there are other reasons, which can be to do with the airway. But again, that's the whole growth and development of the jaws. And if you have the crooked teeth and you have the mouth breathing and you have all of that kind of stuff, it's normally as a result of either you've got very high, narrow arch of the, it's really hard to explain, but if you've got a narrow arch, so the space between your molar teeth is narrow. If you imagine you've got your nose and you've got your mouth underneath, in between the two, you've got a bone that goes through the two of them, right? Like this. And if you've got narrow teeth, that bone flexes upwards because it's not flat anymore. And then if the bone flexes upwards, you've got less space to breathe through your nose. And then that can force your septum to deviate. And then you can't breathe through one nostril. And then your one nostril is fight or flight and one's rest and digest. So it can push you into more or one of the other nervous system, autonomic nervous system responses. So if you are younger and you notice all these things as a parent to your kids, you have to grow, develop, and influence the way your kids are growing and developing through the nutrition, through the breathing, through the swallowing. And that should increase the jaws into a perfect place where the tongue can fit in and not occlude the airway. The nose can, the maxilla can grow, which it means you've got a wider arch, which means you can nasal breathe a bit easier. And your tongue can get into the roof of the mouth and swallow properly and drain the sinuses and drain all of these. Because when you swallow 800 to 2,000 times a day, you actually meant to be draining your sinuses and draining all the stuff from the back of the nose. And people that don't swallow perfectly normally have like a lot of postnasal drip, right? Because your system's not pumped and draining. So there's the teeth not meeting in the right way. There's the muscles spasming, trying to meet in the right way. And then there's the airway that can, if so, let's say that an adult didn't have any of these things, and as an adult has crooked teeth and has all of this, your body has to compensate for breath. And that can be to mouth breathe, because I can't breathe through my nose, so I have to mouth breathe. And when you mouth breathe, it's like a fail safe. It's like a last resort to be able to breathe. You don't want to live via mouth breathing because it puts your body into more of a stress response, which is not good for resting and digesting. But some adults don't have the option because their structure's never grown to the position that allowed them to nasal breathe easily. And if as an adult, it's harder to correct. We can't just change the chewing, breathing. Well, we can, but we're all going to revert to it because the mouth hasn't got the space, and the tongue is there's a great book called 6 Foot Tiger, 3 Foot Cage, which explains the tongue needs to live within a nice free cage of the mouth. And if it's trapped in the tongue, then imagine this is your tongue. It's meant to be up here. Can you see the airway space difference? Because the back of the tongue goes down the throat, right? And if that's trapped back, it's bulging into the back of the airway, which means you can't breathe either. So there's so many little aspects that build up the perfect makeup of how we should be structured. But if you can't breathe properly, you have to compensate. So you have to have more of a forward head posture, you know, like the recovery position, to be able to breathe. And you'll start noticing now your friends and family that have a bit of a forward head posture. That's normally because their teeth are crowded and they can't, and then they have a more open mouth posture to be able to breathe. And all of these things push people into TMD as well, because when we're asleep at night, I know this is a long way to get to grinding, but when we're asleep at night, we lie back and we go into our deep sleep cycles, and everything in our body relaxes apart from our diaphragm. That's the only thing that's breathing, right? And that's the only muscle that's moving. But as a result of that, if we've already got a trapped narrow arch and we can't nasal breathe very easily, our mouth has to open. And when our tongue's in that low position, the tongue can block the airway. So then you have to grind your teeth, push your teeth forward, push your tongue forward, get scalloping on your tongue, crack your teeth because you're clenching so much at night, but constantly it's putting you into fight or flight, which actually can relax your smooth muscles and make you go for a wee all the time, right? So then you don't get a long depth sleep because you need to go for a wee because you were in this fight or flight response from clenching or grinding your teeth, which is actually an airway issue and a structural issue that you never had sorted when you were younger. And on the converse of that, when we have our teeth straightened by pulling these molars, these premolar teeth out, guess what? Makes the arch smaller, pushes the tongue back, gives you sleep disordered breathing problems, gives you TMD. So you've got to be really careful about the intervention you choose as well, because it's detrimental. Yes, you're going to look great, but 5, 10, 15 years, maybe 20 years, how long before you get some kind of holistic problem from that you've not thought about? Yeah, and no one's told you about either, because they don't know, they're not aware of it. I'm doing a master's at the moment in orthopedic orthodontics, which is moving the teeth and growing the skull bone and changing how the skull grows. And I've got lecturers in there pulling out teeth and showing befores and afters and 10-year follow-ups on their lecture slides. And I'm just noticing the forward head posture of all of these patients in 10 years' time, because they've got great teeth still, and they've put retainers behind them, so they've not moved, and they look great. There's no relapse because they've stuck these retainers on. But I'm just thinking of that picture of that person in the world, and I'm thinking, what are their symptoms that they're having that they're not even relating to their teeth, that could be due to their teeth, and no one knows, or no one's telling them. And that's why I'm trying to make this message more clear, because it's such a, well, it's not an easy thing to fix, unfortunately, but it's such an easy thing to become aware of. So at least we can do it for our kids and make things like super easy for them as they grow and develop.
What kind of options are there for adults who mouth breathe and they want to become nose breathers? I know that there's mouth taping, but some people may be worried about having their mouth actually shut. So what can you suggest or advise to adults who want to become healthy nose breathers?
So as adults, it's harder to make the skeletal changes, but they can happen. Just got to work with nature, because when we're growing and developing, you see changes within months. And as an adult, our bone kind of turns over once every 9 months. So you actually can make changes. You just got to have very slow positive pressure in the areas that you want it to, that push the bones to develop in this new and different way. So you can change the way that the skull and jaw bones move, and that's coming more forefront into the last 5 years ago, and it's developing more and more, which is why I'm loving. And there's a master's course now that I'm doing that's only been going for 2 years, so that shows you that there's more research coming out about adult intervention. But with simple things to do, really, if you're worried about this and you're listening to think, oh gosh, that's me, you can quite easily get, if you've got deep bite, crooked teeth, narrow arch, struggle to breathe through your nose, number one is do some Buteyko breathing to improve your nasal breathing, because our breath is driven by our carbon dioxide levels in our system. And we've got to become more used to breathing through our nose if we're a mouth breather, because we inhale a lot more oxygen and we exhale a lot more carbon dioxide. So you're going to feel very trapped, claustrophobic, anxious when you start nasal breathing. And especially if you have a narrow arch, because then that pinches the little pathways into the sinuses, which is where your nitric oxide is mixed with the air to calm down and relax your blood vessels and put you into a more calm state, that the blood and the oxygen goes to more places. So the first couple of months, you probably just want to work on the breath of the nose and just be able to tolerate as much as you can before you mouth tape. That non-panicky feeling, and they become aware that you're not anymore. And then when you get that during the day and you're conscious of it, and every time you mouth breathe, you're like, no, the thing I always say to my patients is, when you notice yourself clenching your teeth, breathing through your mouth, or in a panic, in stress, there's 3 simple things I want you to remember. It's tongue to the roof of the mouth. All right. When the tongue's to the roof of the mouth, you can't clench your teeth together. You can't mouth breathe because the tongue's there. Then you put your lips together and you breathe through your nose. And that's because it's a habit, right? So you've got to take yourself out of the habit every single time, that positive reinforcement. Say, no, Seb, stop. Tongue to the top, lips together, breathe from a nose. So the first 2 months, just focus on that, really. You may go quicker, you may go slower, it doesn't matter, but just focus on that. And then once you're at that place and you want to do 24/7 nasal breathing, you're then probably okay to, I always say, wear always a lower night guard. over your lower teeth, and start small and thin by about 1 mil or 2 mil. And because what that's going to do is when you tape your mouth, if you do have to clench or grind your teeth because you're not mouth breathing anymore, your teeth will slide over each other really easily because you've got a night guard in there and you're not going to damage your teeth while you're doing it. And teeth can take load, but you don't want to be wearing them any quicker than you need to, because our teeth should only touch when we chew our food. And if we have 3 meals a day and a snack, that's only 6 minutes a day, the actual contact time. Any more than that, some people that grind their teeth can be grinding their teeth up to 2 hours in a 24-hour period. So imagine how quickly your teeth wear down compared to 6 minutes a day. It's like 20 times almost, isn't it? The amount of time. So you don't really want to be doing that. So the first thing is the breathing, the consciousness, the awareness of it, then getting a night guard for you to sleep in. And you can start with a lower night guard whenever you want, if you think you're not going to be able to tolerate it. And a lot of us that used to breathe through our mouth, me included, long story, but I was a mouth breather for a few years. So I've been there and I've done it. I had a very strong gag reflex. Because your body thinks something in my mouth, I can't breathe, get it out of my mouth, right? So that's why people normally have a really strong gag reflex. So you have to do the nasal breathing to calm that down and then try and wear something in the lower jaw. Now, the other thing that you can do is ensure that your nose stays open all night by wearing these nasal dilators that go in your nose and hold your nose open. Because what if you tape your mouth and you can't breathe through your nose? You're giving yourself sleep apnea, aren't you? So you kind of want to be sure that you can nasal breathe as well. So now that's the newest addition to my protocol, really. For the last 6 months I've been doing that, and the results have been amazing, even for me. And that was something that I wasn't really considering before, because I thought I can breathe through my nose. But the really easy test to do is if your lips are together and you go a really short, sharp, deep inhalation through your nose like this. You see how my nose collapses on one side? It's because I've got rubbish cartilage in there, so it just collapses. Now, what happens if I'm asleep and I'm lying on that side and all my sinus drains into the other side? Then I can't breathe. So you've got to ensure that it stays open by sleeping in these little nasal dilators. So yeah.
You're the first person to introduce me to nasal dilators, so this is something I'll have to look into because I am a recovering mouth breather, so taking these steps that you mentioned would definitely help me on my journey. So I do have an interesting question. So are you familiar with the vagus nerve in the body?
Yes.
You did mention earlier that like the tongue should be touching the roof of the mouth. So how does that impact the vagus nerve?
Oh yeah, it calms it completely, because just behind your front teeth you have the end of so all of the cranial nerves, they all just completely, well, the vagus nerve is a wandering nerve, like so the biggest one, and it's pretty much most of our rest and digest, our parasympathetic, and keeping the tongue, pushing the tip of the tongue, which actually the tongue itself has 3 cranial nerves controlling it, and then you have 2 cranial nerves coming down just behind the front teeth. So when you actually put the tip of the tongue behind the front teeth, you're connecting 5 cranial nerves. So then that's relaxing your system, as it were. And the vagus nerve is the 10th cranial nerve, and it's just even humming, singing, all of these things that the tongue does actually stimulates vagal tone and helps you relax. But the most important thing is there's a balance, isn't there, in the body? You've got rest and digest, and you've got fight or flight. When one's activated, the other one's not, and vice versa. So they work against each other and they balance each other. So if your tongue's being kept to the roof of the mouth, you're ensuring that your tongue's not in the airway. Therefore, you can breathe. Therefore, your body and your mind says, oh, you can't breathe, clench, grind your teeth to open, or put your head forward to open. Which actually is the sympathetic fight or flight response. So then you're ensuring that that's not being overactivated.
It calms the body overall by having the tongue touch the roof of the mouth. So then my next question would be, are pillows even useful for people? Seeing that a pillow lifts your head up, even if it's thin, I'm sure that there are implications to having your neck forced upwards.
Yeah, if you have a pillow, if you use pillows, I mean, I still use a pillow, just a very thin pillow, but you don't want to be using 2 pillows at all. You want to be really, if you think about the way you stand and the position between your neck and your head, that's where you want it to be, really. So you're looking like maybe, a couple of inches, really, aren't you, of pillow? And the other thing is the position of your head. If it's too high, it can cut your airway off, and if it's too much, yeah. The way that I do it is, imagine a towel that's rolled up, and that's kind of like the thickness of the neck that you want underneath this part here, because you're just supporting that to be like that, really, because you don't want to be like this, because the tongue could then fall into the airway. You kind of want to be like that. So if the tongue's in the roof of the mouth and it falls down into lower jaw, not backwards. You've got to work with gravity. And you know, some like airway dentists say that never sleep on your back, but I think if you sleep on your back in the right way, you can sleep perfectly, because if people sleep on their sides, then you get structural strains and shoulder strains. You know, in reality, do a bit of everything, but it's hard to know what you're doing at night anyway, isn't it? But I've kind of got to this place.
You're like recording yourself to see.
Yeah, exactly.
Let's get into this, because you mentioned how we have enamel that protects our teeth, and it's not technically alive, but the rest of the teeth are living beings. So then inside the mouth, there are other living beings, right? So we have like good bacteria and bad bacteria. So are there any vitamins that we could take that would help the good bacteria thrive? Are there certain foods we shouldn't be eating? Do we even want a balance of like good and bad bacteria in the mouth, or do we like only want good bacteria and take anything else away? Like, what are your thoughts?
Yeah, I mean, my chemistry degree taught me something, that everything is an equilibrium. Everything in the world is an equilibrium. So what you're trying to do is push an equilibrium into the favorable environment in whatever reaction you want. Now, the mouth is no exception to that, nor is the body, to be honest with you. But if you think around the bugs that are living in our mouth, and actually one of my videos was talking about this week, wasn't it, that, you know, we've got more bugs living in our mouth than we do have human cells, which is crazy, including all the ones that our saliva kind of push in. And it always reminds me of those gangster films where they have to dispose of the teeth, right? Because the pigs won't even touch it. But that's how hard they are. They're harder than bone, which is just, you know, when you're learning all your anatomy, you never think of bone being outbalanced by teeth. But yeah, teeth are the strongest things. So those bugs, if they're towards the wrong way, then what can happen is that the balance becomes a negative one. And what can push the balance in the wrong way, right? There's the foods we eat, number one, and I'm going to go back to this for everything. So if we're having whole foods, you're really ever going to get an imbalance, because you've got your probiotics, the ones that can feed off of it. So then diet number one, and if you've got a good diet, your bugs are going to be better. But then also you have your plaque control, which is where like the brushing and the cleaning comes on, because if you have a buildup of plaque all over your teeth and it stays there for, let's say, 2 weeks or longer, the very base layer on the tooth surface with the other stuff on top of it then becomes anaerobic. It can't be fed by oxygen because there's so many stuff. It's like a, you know, like a pile of people just jumping on. And then you imagine the person at the bottom, that's the bacteria at the bottom, they've got no oxygen down there because they can't breathe. There's so many people on top. So then that layer of bacteria, they have to change and they have to metabolize different things. And anaerobic metabolites is, you know, lactic acid. When we're doing too much of our sport and exercise and our muscles get so fatigued, that's where that bacteria comes in, and you say, right, they're producing their version of lactic acid, which then can dissolve our teeth, and that's how the early signs of decay. So you've got the nutrition, which is the strength of the tooth, and then you've got the bacteria, which is the balance of it as well. And you've got to have this perfect balance of both of them. So, but if you brush and clean your teeth, you wash away that plaque, so then there's not going to be a build-up into the nasty ones. So you've got the balance of the bugs and the food, and you've got the build-up of the plaque and the tartar, or the calculus, and then you've got other things that influence that, like, I'm going to go back to the food, but if you've got eating good food, then you've got minerals in your body. So then your saliva comes out and it's more mineralized. So then your teeth remineralize from the phosphates, the calciums, the things that are in your saliva. But if you mouth breathe, you dry out saliva, which is normally when people get loads of calculus stuck to their teeth because they mouth breathe at night, and it dries out at the first place that it comes out because you're mouth breathing so much, and then it doesn't go to all the other teeth to try and provide mineralization for them. So we want good saliva flow and not mouth breathing, which dries out saliva and then allows those things to tip in the other way. And then we obviously have the clenching and grinding teeth as a different reason, because teeth are crystal, the top layer is crystals, and if you crack and break them, then it allows things to go through them. And then you're like, well, I brush and clean my teeth so well, but why am I getting decay in these areas that are clean? And it's maybe because you've got these micro cracks in your teeth that you never really knew were there, but bugs are tiny and they can get through them, and they can feed on the nutritious glucose from within the tooth. So yeah, it's a fascinating balance. So then you've got, right, how can I influence it further? And we've all taken gut probiotics. Gut probiotics probably been around for like, I don't know, 10 years at least now, really going in the forefront of helping people heal from the gut place. But actually there's now companies that have little mints or have little solutions, and you just swish it around your mouth for like a minute and twice a day, and they've got good bugs in there. And the bugs that they put in these bacteria, these positive beneficial bacteria, and the way to always look, if they, I mean, to be fair, if they're sold for that reason, they're going to have the good bugs in them. But the way to always look for the good bugs is they're always called something to do with the mouth. So they've always got like oralis in there, like the oral cavity, or salivaris. You know, it's like these names that just make you think, oh, that must be good. But so if you can introduce them into your mouth a couple of times a day as well, then you're pushing that equilibrium into the positive side, right? So they're kind of the ways that I look at influencing that whole aspect of that dynamic equilibrium, is what they call it in chemistry. But yeah, it's fascinating stuff.
It is. I know we're coming up on the end of our time here, but would love to have you on again, but I do want to just cover, if we could briefly, like generally, how many times should people brush their teeth a day? Is there such a thing as overbrushing? Does a Sonicare toothbrush work better than something as like a standard simple toothbrush? I'm sure many people are aware of like flossing, you know, and like the water pick, which is really, really good for tooth health.
Yes.
But then oil pulling is something that has come into, I think, the majority of people's awareness as well. So it's a lot to kind of cram in there, but let's just go with how many times should we brush our teeth, and is one toothbrush really better than the other?
It's true, is it? So going back to that scenario that I just kind of spoke about there, I guess, was you've got not brushing for too long over 2 weeks creates that anaerobic environment, which is not nice. And the bugs that form there are not the nice ones. But I only brush my teeth once a day. Now, do I recommend everyone to do that? Maybe not, because you need to know what's going on. You need to have regular checkups and blah, blah, blah. But plaque can be beneficial as well. And if you've got a good balance of plaque and you eat a good nutritious food 90% of the time, then the plaque that's in your mouth might actually remineralize your teeth and help with that process and deliver those nutrients into the teeth. So for me, my perfect routine is always plaque control, brush the tongue, because the tongue builds up loads of plaque and it's got little hairs on it that holds food debris and stuff like that, which they can just feed on. And normally if it's holding the food debris, they break down over time, and then it releases more of those fermented carbohydrates, which bad bacteria like to feast on. So then you get this concoction of, and that's why the tongue is normally the place where the bad breath comes from, because that's where it all feeds on. So I brush my tongue morning and night. Like you touched upon, coconut oil pull, I do that after I brush my tongue in the morning, and I normally mix a decent essential oil in there, like a wild orange, cinnamon, a thyme, oregano, diluted with coconut oil, and we swish it around for about 20 minutes. And then that allows, well, one, it works with the saliva and the immune cells within the saliva to trap the bacteria and to swish them all around. It coats the teeth with this like layer and lines the porosities of within the teeth of this fat layer that bugs can't stick to. So then your teeth are at this place which reduces the plaque, which is good because we talked about that earlier. And then once you've done that, you spit it into the bin, otherwise blocks the sinks, people go crazy. And you can either brush your teeth after that, or you can use some natural mouthwash that is either you make it up yourself, just salt and water, or you can add some essential oils in there, just to bind to the excess fat off the tongue and stuff and just spit it away. And toothbrushing, you know, for me, never more than twice a day, because you don't want to irritate the gums. The gums are what attach the teeth to the bone and the ligaments within them. So you want to really be careful with the gums. You never want to use hard bristle brushes, nor do you want to use too soft either, because then it's not going to get away the plaque. So normally medium head, medium bristle brush, and I
Goldilocks.
love the Sonicare personally. So my favorite toothbrush is the Sonicare because the vibration in it has actually been proven to break the little tails off of the spirochetes, which are the nasty bugs that are the ones that cause gum disease. So because it vibrates at that such sonic speed, so actually you're getting rid of the plaque, but you're also trying to dismantle some of the bugs that are in there as well at the same time. And you can brush your teeth like normal, which is a nice good motion. I don't like the ones that you just hold there because I'm thinking, is it doing its job? Is it working? But that's me and my OCD probably. And then yes, interdental cleaning. The most important time for interdental cleaning is right before bed, because you've eaten food all day and you don't want stuff in there all night, especially if you mouth breathe or have any problems there. So the worst time is eating or drinking anything after you brush your teeth at night as well, because saliva flow drops. If you mouth breathe, it goes bone dry, and their bacteria and plaque can feed and create their things. So interdental cleaning, the best for me, it's the water pick, like you said, but also using things that aren't going to cause bleeding, because when your gums bleed, you have a pathway into the bloodstream, and if there's bad bugs living in there, you can cause all of these kind of chronic diseases and inflammatory diseases, and even acute diseases. There's endocarditis where these bugs can eat like your heart valves and you have to be rushed to hospital. It's like crazy. And that's from bugs living in the mouth. So that's rare, by the way. I don't want to scare anyone, but very rare. So interdental cleaning with things like easy picks, which don't have metal in them, and they're quite silicony and bendy, and they don't really prod things. And always using a toothpaste that contains hydroxyapatite rather than fluoride. Obviously, fluoride is a toxin for our whole system anyway. So, you want to substitute that with something that's actually still mineralizing the tooth but doesn't have the negatives, and that's the hydroxyapatite. So you've got to make sure you've got hydroxyapatite in your toothpaste, as well as, if you want abrasive ones, a bit of charcoal in there to keep your teeth looking white. But coconut oil pulling will pull the stains out of teeth at the same time as well, and stop them from getting more embedded. And mouth breathing will stop that as well. So that's kind of the way that I do it. Interdental cleaning at night, brushing your teeth for sure at night, at least 2 minutes, medium head, medium bristle. Sonicare is what I use, but I've even got my going away toothbrush is just the normal manual toothbrush, and it's called a Cura Prox, and it's got all these microfiber bristles in there. It's got like 1,800 of them. And when you brush your teeth with that, I get the same squeaky clean as after the Sonicare, because it's like a microfiber cloth for a toothbrush. I'm like, yes, this is amazing. So it's easy to take away. Mm-hmm. Yeah, it's so good. And then obviously the coconut oil pulling is amazing in the morning, and the tongue scraping morning and night, and you decide whether you need to brush your teeth in the morning or not. But I would say that unless you're really confident that you've got no dental decay and problems going on, definitely brush morning and night just to be safe.
Okay, and very briefly, you did mention about charcoal toothpaste being abrasive. So I do see in the stores everywhere that it's available, and there's kind of like a trend with it. How abrasive is it? Is it able to take away our enamel? Should people use it only just once in a while versus like on an everyday thing? What's your take on that?
So if you look at the hardness of charcoal compared to the hardness of enamel, it's nowhere near it. So I don't think you need to be worried about charcoal toothpaste, but something that is harder than is obviously your gums. So I don't think you want to be using it all the time. So for me, looking at it, you want to be using it just to clean the teeth. I use mine maybe once a week, once every couple of weeks, and I'm using it just to take the stains off my teeth. And you do notice them; they're really good at lifting stains. But yeah, I wouldn't be using it every day. But that's just me, in my opinion. There's been nothing to show that it causes abrasion of the teeth too much. And when you've got to be more careful is when the gums are receded a bit and you've got root surfaces of the teeth showing, and then they're more susceptible to abrasion rather than the enamel, because the enamel is super strong. But it's still weaker than the dentine layer, which is the root surface material. It's still weaker than that. Sorry, is what I meant to say.
Right. Wow. Well, this has been a wonderful conversation, Dr. Seb. I would love to have you on in the future. There's so many other things we could dive into, but where can we find you? I know that you have a social media, right? And it's what can you give us the handle and your website?
Yeah, so I do a lot of social media. Well, I do Instagram. That's about as much as I can tolerate. But biological_dentist is the social media handle for Instagram. And then the website is wonderofwellness.co.uk. And that's I'm actually just next weekend. I'm doing a big update on the whole website, and lots of filming content and free content, and posting remineralization protocols on the website and stuff like that will be free downloads. So I'm going to revamp that website to make it all a bit more flowy than it currently is. But yeah, they're the two places where I put a lot of the information on at the moment. And I try and support people from all around the world, making better decisions for them and their family as well. So I run kind of like online sessions once every couple of weeks, whenever time permits, just for the most urgent things. So if you ever want to reach out to that or have a chat, basically like we're doing now, just about what direction to take, then a lot of people like that satisfaction because it provides them with a peace of mind saying, yes, I'm doing the right thing.
Okay, awesome. Well, thanks so much for coming on, Dr. Seb. This has been so much fun to talk about. And I'm sure that we've all learned a lot about our teeth health and how to make sure that we can have longevity in our mouth. So thank you so much. And everybody, we will see you on the next one. Bye.
Thank you.